In B lymphoblastic leukemia lymphoma, we all know that the MRD is the single most predictive factor, both for prognosis. Patients with positive MRD have a very high chance of unfavorable outcomes, and it can be addressed. Like, additional therapy can be provided for patients to kind of get a negative result. So there are several, there's a lot of variability out there in terms of evaluating MRD, in terms of the sample input, whether it can be bone marrow or peripheral blood, and at what time points do we assess MRD, and what techniques do we use. There are several, ranging from flow cytometry to qPCR and now NGS-based evaluation. Because of this variability and this lack of concrete guidelines, I think that's a major unmet need in terms of standardization of care. Because MRD is so important, whether it's pediatric or adult ALL, that's one thing that we should all come together to kind of develop these guidelines to standardize serial evaluation, provide options for identification, probably involve interpretation expertise, and some technologies can be hard to interpret and requires pathology expertise, especially flow cytometry. I think that's where the expertise in ALL can come together to kind of develop this in the near future.